Hi everyone, my name is Yajun Si. I'm a research associate professor in the Survey Research Center at University of Michigan. I also teach in the Michigan program in Survey and Data Science in the Institute for Social Research. Today, I'm going to talk about how to apply a data equity lens to weighting in longitudinal studies. This is one of the training theory slides offered by the Center for Health Policy Research at UCLA. You can get copies of the slides by the email request. You can also view recent recorded seminars on this website. So what are longitudinal studies? They are also called panel studies in survey research. We collect rich data about individual characteristics and follow them over time. This would allow us to estimate trajectories. If we are interested in behavior and health matters, we can look at the trajectory modeling. Longitudinal studies are one fundamental approach to understanding the developmental course and the lifespan. The examples of longitudinal studies include the Monitoring the Future panel study, which is organized by researchers at University of Michigan, the panel study of income dynamics, the House and Retirement Study, the Midlife in the United States series, and others. Longitudinal studies are popular, but they are subject to selection bias when the participants are different from the population of interest, and they are also subject to non-response bias, which is the focus of this presentation. In longitudinal studies, there are two main types of non-response. If we look at non-response and the follow-up with, if one individual fails to provide data for the entire wave, we call this as unit non-response, also as attrition. But if the participant has agreed to join the data collection, but only provided answers to part of the questions, we have item non-response. In recent data collection, the response rates in surveys have been dramatically declining. So this causes more concerns about selection or non-response bias. If the study respondents are systematically different from non-respondents in terms of survey outcome distributions, we could have biased estimates. When we look at non-response, we should start by examining response patterns. Here we have a monotone response pattern, which means that if the participant drops out in one study, he or she will not come back in subsequent waves. The right side shows a response pattern that is intermittent. That means if the participant has missed a particular wave data collection, but comes back in subsequent waves, we have intermittent response pattern. We often create response indicators to represent response patterns. So here we use R with the value 1 indicating response and 0 indicating non-response. Creating response indicators is helpful for us to model non-response mechanisms, which means that we are looking at stochastic non-response mechanisms rather than deterministic. We assume that every unit has a non-zero probability to respond. So we can model the response probability or propensity, which is essentially the probability for the response indicator to take on the value of 1. There are 3 main response mechanisms. As the missing data mechanisms, we could have missing completely at random. The respondents are a simple random subsample of the base sample. This is the most ideal case, but it is hardly the case in practice. In practice, researchers often assume missing at random. That is, the probability of response depends on the observed information. However, if the probability of response depends on the missing values themselves, this creates missing not at random. This would be the case that would cause biased estimates if we only use the longitudinal data themselves. However, in practice, without additional information, we cannot verify missing at random assumptions. The non-response bias, this expression depends on the quantity of interest. Commonly, we look at the non-response bias of the respondent mean. Here I use small y bar r to estimate the population mean of interest. The non-response bias of the respondent mean can be approximated as the product of the inverse of the average population response propensity and the covariance between the survey variable y and the response propensity. So you can see that the response rate is only part of the picture of non-response bias. In practice, researchers are often concerned about low response rates. If we have low response rates, we could have large non-response bias, but if the response propensity is independent of the outcome of interest, even with low response rates, we could still have unbiased estimates. So response rates are only part of the picture for the non-response bias. It only provides partial evidence of the risk of the non-response bias. We have developed a flowchart showing the steps for non-response bias analysis. We recommend starting from analyzing missing data patterns. Is it monotone or intermittent? Identify key survey measures of interest and the associated analyses. Model the key survey variables. Try to select strong auxiliary variables. So the auxiliary variables should be highly correlated to the key survey measures and the unit non-response. So we can use them to model the unit non-response. After modeling, we can classify using the observed covariates. We can construct weights. We compare the weighted estimates with external estimates. Because we cannot verify the assumption of missing at random, sensitivity analysis is often recommended to assess the missing at random assumption. All these steps are focusing on unit non-response, we also need to handle item non-response, which is often handled by imputation. So how to construct weights in longitudinal studies? The most popular approach is propensity score weighting. We fit a model to predict the response propensities based on available predictors. And this model could be a parametric model, such as a logistic regression, or machine learning algorithms. After we predict the response propensity, we can use the inverse of the predicted response propensity as the weight. If the predicted response propensity is small, we may get extremely large weights, and this leads to the second option, which is to construct weighting cells or classes. For example, we can use the quintiles or decimals of predicted propensity scores to construct weighting classes. Then within the weighting class, we can compute the observed response rate within each cell or use a summary of the predicted propensity as the response propensity in that weighting cell and treating that inverse value as the weight. The key to success in the weighting adjustment is the existence of highly predictive auxiliary variables. These variables should be strongly related to the survey outcomes, and to use them, they have to be available for both respondents and the non-respondents. Here, we have a 2x2 table showing the effect of weighting adjustment on the bias and the variance of a sample mean estimate for the population mean by the strength of the correlation of the adjustment variables with non-response and the association with the survey outcome of interest. You can see that only when the adjustment variables or those auxiliary variables are highly correlated to the non-response and highly correlated to the outcome, the weighting adjustment would reduce the bias and the variance. So after we have the predicted propensity score, by the same justification of the propensity score, which is essentially a balance score, we can use the weights, so their inverse values, as a summary to represent the information from the auxiliary variables. So in longitudinal studies, there are multiple weighting options. First, whether we should use the complete cases or available cases. So complete cases are restricting to the participants that have responded to all waves. And this resulting number of complete cases could be small in longitudinal studies if you have a large number of follow-up waves. And the available cases include any data collection as long as that participant has responded to any wave. So different ways can be constructed using either complete cases or available cases. And we can also use different weighting adjustments depending on the response patterns, whether it's monotone or intermittent, and available information. Here I'm giving you the concrete example from the monitoring the future panel study. This MTF panel study follows a sample of US 12 graders with a model age of 18 every 1 or 2 years. The goal is to study changes in the beliefs, attitudes, and the behaviors regarding substance use and other health risks. The longitudinal follow-ups permit examination of developmental changes within cohorts. So the cohorts are the recruitment cohorts across years. We have conducted a study by analyzing 4 cohorts of MTF panel data to study or estimate trajectories of substance use from late adolescence through young adulthood. The covariates were selected based on substantive experts. So we are based on the substance use literature, because the key to success in non-response bias adjustment is the availability of auxiliary variables that are strongly related to the survey outcome of interest. So this selection of covariates based on substantive information is very important. So in this MTF study, also common in other longitudinal studies, we can have time varying and time invariant measures. So the outcome of interest are repeated measures of different substance use behaviors. So we have checked binge drinking behaviors over time, and also tobacco or marijuana use across time. In addition to the time varying outcome, we have time varying predictors. Here we include the follow-up wave indicators, which can also be replaced by years, full-time 4-year college attendance status, and marital status. These predictors' values change across waves. We have gathered a long list of baseline characteristics, such as the cohort indicators, the year when the participant was recruited, their baseline age, sex, race, ethnicity, high school grades, parental education, and the baseline measures of the corresponding substance use outcomes, and others. So together, the total number of baseline characteristics is around 70. We treat them as fixed. They don't change over time. Because MTF is a probability sample, we also want to account for the complex sampling design features. They oversample those who have reported drug use. So we included the drug use reporting status, sex, and the sampling strata in the analysis. When we construct weights in longitudinal studies, we typically make missing at random assumption. So we assume MR applies to all non-response mechanisms at each weight. This allows us to construct weights using the available or observed information. Again, we should at least conduct the sensitivity analysis to assess the assumption of missing at random. If we want to extend to handle missing not at random, we need additional information or stronger modeling assumptions. So under the missing at random assumption, we have different weights. So the first standard set of weights are constructed only using baseline characteristics. So we look at the response indicator for each follow-up wave. Then we model them by a response propensity score model with only baseline covariates included in the model. And after this prediction, we use the inverse of the predicted response propensities as the weights. So you can see that only using the baseline information, we are not accounting for or including other data of the same participant if they have participated in more than, say, 2 waves. So as an alternative to better use the available data, we can express the response probability as a product of conditional probabilities given response at previous waves. So for example, when we try to construct the weights for wave 3, in addition to the baseline characteristics, which we call it wave 0, if they have participated in wave 1 and 2, so we can first model their response propensity for wave 1, then conditional on their participation in wave 1, we model their participation in wave 2. So then in the end, the final weight or the response probabilities for wave 3 will be the product of the conditional probabilities given responses at previous waves. And this approach allows us to better use available data, but it depends on their response behaviors at previous waves. If they are not there in the previous wave, then we cannot get this conditional probability. So this is a better option for monotone missing miss pattern. After we get the predicted response propensities, we can construct weighting cells or classes. So I mentioned the observed response rate, we take their inverse as the net response adjustment factor. Alternatively, we can also look at other summaries, say the average of the estimated propensities in that weighting cell, or their median values. Then we take their inverse as the adjustment factor. As an alternative to the parametric model, for the response propensity score modeling, we can apply machine learning algorithms. So the goal is to classify units as respondents or non-respondents based on covariates available for all respondents and non-respondents, so all sample cases. And the data input are the same as those for the propensity score modeling. Machine learning algorithms are black boxes. They offer lots of flexibility in terms of including or automatic selection of high-order interaction terms, the automatic selection of covariates and their associated interactions, and the values, whether they are categorical or continuous, are combined automatically too. So then after we get the predicted value using the machine learning algorithms, we can similarly perform or construct weighting classes so that within each weighting cell, the units have the same response probability given the covariates that define the weighting cells or classes. After we have constructed the weights, it's important to evaluate the weights to conduct quality check of weighting. So typically we recommend calculating summary statistics of the weights including the mean, median, minimum, maximum, and the design effect. The variability of the width is captured by the design effect due to weighting. We use this formula 1 plus the squared term of the coefficient of variation of the width. This is an upper bound of precision loss because this calculation assumes that the weights are independent of the survey outcome of interest. Anyway, it gives us a conservative estimation of the precision lost due to weighting adjustment. Because of the way of construct width, we often have extreme values of width. Then we need to consider whether we should trim the width to smaller values or adjust the outcome values that are attached or correspond to the cases with extreme values of width. That approach is called Winsorization. We can compute weighted frequencies of key survey variables and compare them to reliable external totals or external information. We can check a balance on key covariates after weighting. So after we have constructed the weights and evaluated the quality of the weights, we need to decide how to include the weights in our analysis. When considering approaches to the analysis of longitudinal survey data, it is very important to clarify the analysis objectives. So with longitudinal data, we can be interested in descriptive estimation at a particular wave, say at baseline or at wave 6. We may be interested in estimation of changes across 2 waves, say between baseline and wave 1. So we use wave 0 to denote baseline. Sometimes we are interested in estimating trajectories across 3 or more waves, such as the analysis goal of using the monitoring the future study. We were interested in estimating the trajectory of substance use behaviors across 7 waves. Once we have clarified our analysis goals, we need to evaluate the effect of weighting on our analysis. The starting point is to compare weighted and unweighted results. If in our analysis we detect large changes in the parameter point estimates before and after weighting, this indicates model misspecification. At the very least, we should use width to offer some robustness against the model misspecification. We recommend further investigations about model misspecification to improve the model. If we only observe small changes in the parameter estimates, but their variances get inflated or get much larger after weighting, this would suggest that the model misspecification could be found or appropriate, and we may be fine if we only use the unweighted models. So that said, we can ignore the weights in this analysis if we see small changes before and after weighting. So in practice, we recommend starting by fitting an unweighted model that includes all predictors of interest, and then sequentially we add the weight and all two-way interactions between the weights and other predictors. Then we can assess whether the weights are significantly related to the outcome or any of the two-way interaction terms are significant. If they are not, we can ignore the weights. But these are all empirical ways to compare weighted and unweighted results, but they are all practical recommendations. So in longitudinal studies, overall, we recommend available case analysis, so utilizing all available information and account for the correlation due to clustering. So because we have repeated measures of the same participant over time, this clustering is important in longitudinal trajectory modeling to make sure we are appropriately accounting for the variance or estimating the variance. We should spend more efforts to improve the model specification. So the model specification is very important. With correctly specified models, weights will only reduce precision without changing the point estimates. However, if the model is misspecified, the role of weights depends. We should spend more efforts on improving the model specification. So use weights with caution. Andrew Goldman has a paper in 2007 that starts with the first sentence, survey weighting is a mess. So it has caused a lot of concerns and arguments in the survey research field to make sure that we use weights with caution. So far, we have considered marginal approaches. So when we model the monitoring the future longitudinal data, we used weighted generalized estimating equations, the weighted GEE for population inference in correlated data modeling. So we have repeated measures of the same individual over time. We account for that correlation using GEE. These marginal approaches with weights are fun if you have appropriately accounting for the sampling error in the variance estimation. However, if we are interested in multi-level models to estimate conditional effects, when we use weighted maximum likelihood estimates, which maximize the pseudo-likelihood function that weighs each individual's likelihood function or contribution to the likelihood by the power of the weights. The literature has shown that weighted likelihood function for a multi-level model requires the weights for both levels if we consider individuals and clusters. So we need the weights for each participant and the weights for each clusters. So in longitudinal study, we need the weights for the follow-up wave, and we also need the weights at the baseline. So we need the weights at each level of the data hierarchy. But in practice, we may only have access to the final weights rather than different levels of weights. And recently, most of the new developments have been using Bayesian approaches to account for survey design in the analysis. So the takeaway messages of this presentation are mainly about why we use weights, how to construct weights, how to use weights, and we should start by checking the response pattern and the response mechanisms, whether they are monotone or intermittent. Do you assume missing at random? Is that reasonable? Do we have highly correlated predictors or auxiliary variables? When we construct weights, there are different options, and whether we are using the complete cases, available cases, are we using only the baseline information, or we should look at this sequential weighting and adjustment by using information from previous weeks. And the key to success is the availability of auxiliary variables strongly related to the survey outcome of interest and the response. After we get the predicted response propensity, we can use inverse propensity score weighting or construct weighting cells. And the effect of weighting adjustment depends on the analysis goals, what are our quantities of interest, and the model specification. If the model is misspecified, at the very least, we should use width, but more efforts should be put on improving the model specification. To conclude, we should use width with caution in practice. Here I provided a list of references cited in the slides. Thank you for your attention.